Good evening, everyone. My name is Letha Ross. I'm a nurse practitioner here at Mercy Health and a member of Springfield Links Incorporated. Thank you for joining us tonight. Tonight, it is my pleasure to introduce Springfield, Ohio native Dr. Soumya Neeravatla. Dr. Neeravatla is a cardiothoracic surgeon whose passion is promoting better health and wellness within our communities. After graduating as valedictorian from Springfield North High School, she attended Northeast Ohio Medical University. She completed a residency in general surgery at the Allegheny General Hospital in Pittsburgh and cardiothoracic surgery at Jackson Memorial University of Miami in Florida. After residency, she pursued advanced training in robotic thoracic surgery at Baptist Health System in Miami and structural health at Emory Healthcare in Atlanta. She launched and served as director of the Structural Heart Program and Robotic Thoracic Surgery in Savannah, Georgia, prior to returning to Ohio. At Springfield Regional Medical Center, she has spearheaded the lung cancer screening program, the expansion of minimally invasive cardiothoracic surgery, and launched TAVR, a heart valve replacement procedure. Dr. Neeravatla has special interest in endovascular and minimally invasive surgery, collaborating with her father, Dr. Surinder Reddy Neeravatla, author of Spring Salt Kills, outside of the OR in his mission to spread awareness about the prevention of cardiovascular disease. She is a popular medical speaker and has given many talks to medical communities and the general public, including an invitation to personally speak to the governor of Ohio and the Ohio Department of Health about lung cancer. Please welcome Dr. Neeravatla.
Thank you, Letha, for that very kind introduction, and thank you for the invitation to speak tonight. I'd also like to thank Links for the invitation and the opportunity to spread the message and tell the story about lung cancer, especially during this time of COVID-19. As you may know, November is Lung Cancer Awareness Month. If you didn't know, now you do. In order to make this evening's talk a little bit more interesting, I decided to tell you guys a story. It's a story that starts like many other stories. It has villains and heroes and weapons and other twists and turns that I think you'll enjoy. Once upon a time, in a land not too far away, in a time not too long ago, it was a dark and dreary world where a tyrannous villain called lung cancer ravaged the land. Lung cancer is the #1 cancer killer in men and women in the US and in the world. Not too long ago, lung cancer caused more deaths than colon cancer, breast cancer, prostate cancer, and pancreatic cancer combined. Lung cancer is such a big problem that locally, it is the #1 cause of death in Champaign County and the #2 cause of death in Clark County, period. Which means that more people die from lung cancer in Champaign County than heart disease, which is typically the #1 cause of death. Lung cancer ravaged its victims through weapons like any other villain, but he was sneaky. He used things like cigarettes, where he would trick his victims into becoming addicted to these cigarettes, and they would then fall for his treachery. The American Lung Association advises the public against both e-cigarette and marijuana use. If you think about it, inhaling anything hot is not good for your lungs. So whether it's marijuana, a vaping solution, or anything else, you shouldn't be inhaling it. And exhaling it isn't so great for your loved ones either, because secondhand smoke of both are also unsafe. If that was not enough, sometimes you would use something called radon, which is an odorless, tasteless, difficult to sense gas that can also cause lung cancer. If you have not had your home tested for radon, you can contact your health department to find resources that can help you get tested for radon. While cigarette smoking is by far the most common cause of lung cancer, it causes more than 80 to 90% of lung cancer, it is still not the victims who are to blame. And so before we proceed on with the rest of our story, I'd like to go on to a side story. So for our side story, I wanted to talk about the villagers who were victims of this tyrannous devil. Lung cancer affects more blacks than whites. It used to be that about 74 per 100,000 blacks would get lung cancer compared to about 64 per 100,000. African Americans are more likely to smoke menthol cigarettes as opposed to regular cigarettes, and that actually makes it more difficult for them to quit smoking, which is another way the devil was very tyrannous and treacherous in laying waste to the lands. He found different ways to trick his victims. Black Americans were also less likely to get treatment. Even though there was treatment options available, they were less likely to get treated, and the death rate was also higher in Black Americans compared to the white Americans. Fortunately, there is some good news, and our hero, who I'll speak about shortly, has made some progress. And now the gap between Black Americans and Caucasians is actually narrowing. And our data in Ohio shows that the incidence rates comparing the two are closer to 67 in Black Americans versus 64 in our Caucasians. And so despite the fact that lung cancer can affect blacks more than whites, it affects rich and poor alike, villagers and city dwellers alike. It doesn't matter where you are or where you're from, you were not immune to lung cancer's treachery. Lung cancer also has some weapons in development, and some of those weapons are marijuana and e-cigarettes. And to be frank, we don't know enough about marijuana and e-cigarettes to be able to quote numbers. As you can imagine, it's hard to do a study about marijuana when up until recently it wasn't legal to do so. But we do know that smoking marijuana, smoking anything, is damaging to the lungs. And we do have some early data to show that marijuana is damaging to the lungs. Vaping also is damaging to the lungs. And contrary to what people think when the term vaping makes it sound like it's a harmless gas that you're just inhaling steam and exhaling steam. But really what an e-cigarette is aerosolized toxins. And so those chemicals that make that vape solution smell good and taste good, those are all little chemicals that get aerosolized and inhaled into the lungs and get stuck in the airways. And so those toxins are damaging to the airways. We don't know the exact numbers of how many lung cancers that's causing now, but we do know certainly that it is not good for the lungs. And what we also know is that we've already seen an increased incidence of people who are having lung collapse due to vaping. So we know that some people try vaping in order to quit smoking, but we actually have several lung associations that have shown that there is no data to show that vaping or e-cigarettes is actually a safe alternative pathway to tobacco cessation. The other thing that lung cancer used as one of its weapons was an excellent marketing team. And the role of his marketing team was frankly to make sure that no marketing happened, was to make sure that people didn't talk about lung cancer so that he could sneak about in the dark and terrorize people in secret because people wouldn't talk about it, and he could keep his tyranny spreading without anyone talking about it. And to take it even a step further, creating guilt and shame in the victims and making people feel like lung cancer patients deserved lung cancer because they smoked. And that in and of itself was part of lung cancer's brilliance. So this is the part of the story that we've all been waiting for, where our hero or heroine, I'll let you pick the gender-neutral protagonist's gender, decided they couldn't tolerate this tyranny anymore. They got tired of all the villagers being victimized by lung cancer. And so they started recruiting a team of shining bright knights. And as part of the team, one of the members was surgery, The other member was chemotherapy, and the last member was radiation therapy. And every good fairy tale needs a fairy godmother or two. In this case, we have lung cancer awareness and, of course, research. And our fairy godmother's magic is, of course, money, part of it. The more money that is donated to research, the more research we can do. And unfortunately, that is someplace where lung cancer is still behind. Despite being the #1 cancer killer in men and women in the US, pretty much any way you slice it, the amount of research funding that goes to lung cancer is actually less than 10% nationally, and actually less than 6% from federally. But fortunately, that's not the only source of magic for fairy godmothers. They also rely on people like you and me to send them positive thoughts, to start caring about people, to send compassion, to wish someone who's had lung cancer encouragement rather than making them feel bad about their diagnosis. And all those positive thoughts give the fairy godmothers more magical power to help our knights. And in doing so, they helped our knights become even more specialized. And so surgery became more advanced, and I'll talk about our surgical knight a little bit more in detail in a second. But one of the things that we were able to do with surgery is become less and less invasive and dive into something called robotic surgery, which I'll talk to as a separate side story in a second. But that wasn't the only knight that became specialized. Chemotherapy became specialized and added immunotherapy and targeted therapy, which now allows patients who have advanced stages of disease to still have a comfortable life for sometimes years, compared to previously it was only months. Radiation therapy also became specialized, and we have something called stereotactic body radiation therapy, or SBRT, which is basically the fancy word for something we sometimes call radiosurgery. For patients who aren't candidates for surgery, they now still have an option for treatment. So all these specializations helped our knights become even more powerful in fighting this villainous lung cancer. But before I cut to the next part of the story, I did want to talk about our knight that's the robotic surgeon that specialized in robotic surgery. Robotic surgery allows us to get the surgery done much less invasively with incisions that are about as small as my finger. And sometimes patients are able to go home within a couple days of surgery, and they recover much, much faster. And we're actually going to show you a little clip here that shows an example of what it's like during a surgery. This clip is actually going to show where you're able to take those lymph nodes, which are sometimes have hidden cells of that lung cancer's villainy hidden inside the body. And we can do that much more precisely with the robotic surgery as depicted in this video. There's also another video here where you can actually see some of the steps of the robotic surgery, where we're able to divide the arteries and the vein and the airway, all with very little blood loss compared to traditional surgery. And the incisions at the end are much, much smaller compared to traditional surgery, so not only does it look better, but patients feel better. These team members worked together to fight back lung cancer and to push it back and annihilate its tyrannous ways, which of course is not an easy task. They used various weapons to help them defeat lung cancer. And part of what we use to find lung cancer are various what we call diagnostic tools to find the lung cancer. And these tools include various ways of biopsy. We have something called a CT-guided biopsy, where a radiologist can take a needle from the outside and biopsy the lung cancer and find what it is. But we also have advances where we can put a camera through the throat and we can get biopsies from the inside, called navigational bronchoscopy. Or we can do something called endobronchial ultrasound, where we have an ultrasound probe at the end of the camera, where it allows us to find masses that are near the airway. But more importantly, it also allows us to, without making an incision, see if the tumor has advanced into the lymph nodes near the airway, which becomes important for us to find out how advanced the cancer is. So using all these tools, our hero or heroine and the team of Shining Knights was slowly making progress. But along came a game changer for the Heroes team, and that was our version of Excalibur, which was the lung cancer screen. And so here I'd like to talk a little bit more about our Excalibur. So what is a lung cancer screen? It's a low-resolution, low-dose CT scan, which means that patients get much less radiation compared to a regular CT scan. It's painless. It doesn't require an IV, no blood draws. It takes less than a minute. And if you think about it, when you compare it to a mammogram, which is a screening tool used for breast cancer, or a colonoscopy, which is a screening tool used for colon cancer, or a rectal exam, which is part of what we use to check for prostates, it's a much easier test. And it's usually covered by insurance for those patients who qualify. And who should utilize Excalibur, or who should Excalibur be utilized with? And those are the patients who are at high risk. And those are patients who have a long-standing history of smoking, which we call 30-pack years. But to simplify that, that's someone who's basically smoked for 30 years, a pack a day, or someone who smokes 2 packs per day for 15 years, or 3 packs per day for 10 years, or any combination thereof. And so if they have that 30-pack year heavy smoking history, even if they've quit smoking within the past 15 years, as long as they're typically over the age of 55, they would usually qualify for lung cancer screening, as long as they're asymptomatic and haven't had a scan for another reason. Why is the asymptomatic piece important, and why is Excalibur such a big game changer? The reason for that is that lung cancer is usually asymptomatic. That means people don't have any signs of being ill in the early stages. It's usually a small lesion that's not touching anywhere else in the body, so it doesn't irritate people, so they don't even realize that the tyrannous villain that is lung cancer is ravaging through their body. So the lung cancer screening tool, or Excalibur, allows us to find lung cancer before the tyrannous villain makes too much progress and makes someone too ill for us to be able to do as much about it. And so with these tools, our hero or heroine had started making progress. And finally, compared to prior years where every year more people were dying from lung cancer deaths were finally starting to decrease, to the point that in 2020, we had anticipated 135,000 deaths compared to the prior years where it was closer to 150,000. Now it's still the most common cancer killer, but we were making progress. But like any good story, we hit another plot twist. So now our gender-neutral protagonist, armed with a team of not only regular knights, but specialized knights and the fairy godmother's magic and Excalibur, started making some inroads against the villainous tyrant that was lung cancer. Lung cancer deaths started finally decreasing. And so the deaths that we're expecting in 2020 is actually around 135,000 compared to prior years where it was 150,000. Before this, lung cancer deaths were going up every single year. And now lung cancer causes more deaths than breast, colon, and prostate combined. So at least we've been able to take one other cancer out of our statistic. And so our team of courageous heroes was not only making inroads against lung cancer, but racial disparities were also improving. As I mentioned previously, especially in the state of Ohio, the gap between the incidence in lung cancer in blacks versus whites was decreasing. But like any good fairy tale, there was a plot twist. And in our story, that plot twist, of course, was COVID-19. The pandemic has affected cancer everywhere, but in particular, it has led to a delay in cancer diagnosis. And so while we had been pretty consistent in how often we were using our Excalibur and how often we were using all these other tools, and basically how many people we were diagnosing with lung cancer for the prior year plus, all of a sudden, when COVID struck, our rate of diagnosis went down dramatically. And while finding less lung cancer may initially sound like a good thing, it's really not. Because unfortunately, it doesn't mean that lung cancer has found fewer patients to infect and victimize. It just means that it has used another one of its weapons, which is the suppression of the message. Lung cancer has the ability to shame our communities, to feel bad about lung cancer, but also to hide the message and stay in the dark and keep the message in the dark. And so it used the COVID-19 pandemic to again sneak back into the dark and bring the patients with it. And so now we're not finding those patients that have been victimized by lung cancer, which means that their diagnosis is being delayed, which unfortunately means that they're more likely to be found at a later stage. And that means that their survival is not going to be as good, their outcomes aren't going to be as good. And unfortunately, we are expecting that there are going to be more deaths due to lung cancer because of this delay from COVID-19. And every good story has a bard who every once in a while reminds us that the story's not over yet. So while things may be bleak, this is not the end of our story. So we can still do something about this. We can empower our fairy godmothers with more magic, whether that be donating to research or donating to lung cancer awareness, whether that be we start spreading the message on Facebook or other social media sites that we have access to. Or if you know someone who's a smoker, if you love a smoker, suggest a scan. Remind people about lung cancer screening. Start talking about lung cancer. Remember to buy a lung cancer awareness pin. Lung cancer awareness's color is actually white, which is why I'm wearing white today for our story time. Remember to wear white. Buy a lung cancer awareness t-shirt. Remind people that November isn't just about elections and football, Thanksgiving and Black Friday. Those are all important things, of course, but remind them that November is also Lung Cancer Awareness Month. And unless we all band together and help our fierce and courageous knights and empower our fairy godmothers, that we cannot defeat the evil tyranny that is lung cancer. But once we do so, we may be able to get our happily ever after.
Dr. Naravetla, thank you so much for that wonderful presentation. And several of our viewers have already submitted questions. As you know, with the pandemic and everything, we're having to maintain social distancing. And with these questions and your presentation, I think we're going to be able to help our community. So with that, can you answer a few of these questions? How many people are diagnosed with lung cancer each year?
Absolutely, that's my pleasure to answer the questions. And I do want to mention that it really is appreciated that Lynx has made an effort to still get this information out despite COVID and create quite a production, honestly, to get this information out to you while still practicing social distancing guidelines, making sure everyone's wearing their masks, lots of hand washing, and making sure that we here are 6 feet apart. So we do want to make sure that we encourage everyone to continue physical distancing whenever possible and practice those safe measures to try to prevent the spread of COVID-19. But on to your question about how common lung cancer is. There's almost 250,000 new cases diagnosed of lung cancer every year. And as I mentioned previously, fortunately, the number of people that are dying from lung cancer is decreasing a little bit. And this year, the expected number is about 135,000. Now, those estimates were prior to the COVID pandemic. And as we had talked about, there was a significant decrease in the number of people that were diagnosed. So we'll have to see how that actually impacts those numbers. But those are the current estimates.
Okay, thank you. So my next question is, why do so many people get lung cancer, and can it be prevented?
Excellent question. One of the most common causes for lung cancer is smoking and tobacco. And the prevalence of tobacco utilization is the most common cause for lung cancer, and that's one of the reasons why it is so common. And therein also lies the answer to the second question. The way to prevent lung cancer most commonly is to not smoke. And the best thing you can do for yourself is to never pick up a cigarette. It sometimes just takes one cigarette to become addicted enough that you become a lifelong smoker. So the most important thing that you can do for yourself for so many reasons is to never pick up that first cigarette. However, if you have picked up that cigarette, it's never too late to quit. And in fact, there's some data that looks at patients who have lung cancer, have already been diagnosed with lung cancer, that are smokers. And we actually looked at patients who quit smoking after diagnosis of non-small cell lung cancer versus those who continued to smoke. And the ones who quit smoking actually did twice as good as the ones who continued to smoke. So even after a diagnosis of lung cancer, it is not too late to quit smoking.
Okay, great, thank you. So with that, what are the symptoms of lung cancer that a person might notice?
So the most common presentation of lung cancer is actually asymptomatic, which means you might not have any signs. You may feel completely normal. Early stage lung cancer typically does not show any signs or symptoms. As it becomes more advanced, or in some rare early stages, patients can have symptoms of fevers, cough, shortness of breath, specifically coughing up blood. But the reason why it is so important to get screened is the fact that so many people don't have any symptoms, and we have to try to catch it before it gets so advanced that it starts causing symptoms.
Okay, thank you, that's very good. Can a person survive lung cancer, and why is early detection so important?
Another excellent question. Early detection is really important because we can, the earlier we catch it, the earlier the stage of the cancer is. And the earlier the stage of the cancer is, the better the survival is. Okay. And unfortunately right now, we're only catching less than 1 in 4 patients in an early stage of lung cancer. 3/4 of lung cancer cases that we're finding right now are in those later stages. And as we get to later stages, the survival is worse and worse. The further the stages, the worse the survival is. And in fact, stage 4 can be as low as 5% survival. Whereas stage 1, depending on the subgroups, is anywhere from 50 to 90%, depending on what subgroups and different studies you're looking at. So the survival rate when we catch it earlier is much, much better than when we catch it later.
My next question is, where can I get lung cancer screening? Can I get it in Clark, Champaign, and Greene County?
Another excellent question. So lung cancer screening is available in Clark, Champaign, and Greene counties. So we have it available not only at the hospital in Springfield, but actually at the imaging center in Springfield. It's even more convenient at the imaging center, much quicker in and out, especially when it's scheduled in advance. We have the Enon freestanding ER, which is very accessible for those living in Greene County. And then we have the Urbana Hospital that is set up for lung screening as well for those living in Champaign County.
Okay, my next question is, who can get the criteria for getting a screening, and can people who've been exposed to secondhand smoke?
So the people who should be getting the lung cancer screening are those who have a primary smoker, heavy smoker history, and they need to have a 30-pack year history, which means that they've smoked either 1 pack per day for 30 years or 2 packs per day for 15, or some combination of that math. They need to be current smokers, or they need to have quit within the last 15 years. They need to be 55 to 80. The upper end is a little bit variable depending on insurance. They need to be currently asymptomatic and also not had a CT scan in the last year. Because if they'd had a CT scan in the last year, it would catch it already, and then they would just need another scan a year from when they had their last CT scan. Okay. If they're having symptoms, we would actually get a diagnostic CT instead of a screening CT. We don't recommend this screening tool for secondhand smokers because even though they do have a risk of lung cancer, their risk is so much lower than those who have primary smoking exposure that the chances of us finding something that is actually not cancer is higher. And so when we talk about screening, there's something called false negatives and false positives. And so what we're trying to do is find the population where the odds of seeing something abnormal is more likely to be something abnormal that we need to take care of. In a secondhand smoker, if we find something that looks abnormal on a CT scan, it is more likely to actually be something that's normal, which can actually just be more anxiety provoking for a secondhand smoker, but also lead to unnecessary biopsies, which can also have some complications like lung collapse. So we would be unnecessarily putting them through risk when their risk of lung cancer is much lower than someone who has actually been a smoker most of their life.
Okay, great. Thank you so much for those. So this month, November, is Lung Cancer Awareness Month. So speak to, I remember back in the lobby, you mentioned something about pearls.
Yes. So that's a question that is close to my heart. So Lung Cancer Awareness Month is November, and it often gets forgotten. And many people don't realize that the lung cancer awareness color is actually white or pearls. And so there's a reason why I'm wearing pearl earrings and a pearl necklace and a white suit this evening for this presentation, to spread that awareness that for lung cancer. And it's my hope that more people will be wearing white in November's to come, just like we paint the town pink in October.
Yes. Thank you for that education. I will be sure and wear my white sometime this month. Okay. What advice would you give to providers and screeners to have people who are hesitant to have screening done during our pandemic and for fear?
And this brings back the plot twist that I talked about earlier in our story. So COVID-19 has had a dramatic impact on our ability to find cancer because patients are nervous about going in to get screens. People are staying home, which is good, and we do encourage everyone to continue those safe practices, and I cannot reiterate the importance of that enough. It's important to wear masks, it is important to physical distance, it's important to practice hand hygiene. The thing that I can assure you, though, is all these facilities that are set up to do screening are practicing all those safe measures. Yes. They are practicing the physical distancing. They are wearing masks so that you're not exposed to their germs. If they're getting checked for temperature every day, they're requesting people who come in to go through a temperature check. If there's any kind of procedures that are being done anywhere near those facilities, those patients who are having procedures done are actually getting screened for COVID. Patients that are getting a lung screen wouldn't require a pre-screening, but if someone's getting something done a little bit more invasive, that would require them not to use their mask, for example, that could potentially create a contamination, those patients are getting screened for COVID. So we're minimizing the exposure of COVID in our facilities, in our equipment. Patients that have COVID are getting put in negative pressure rooms, separated from all the other patients that don't have COVID. So there are ways to safely screen people, and we need to start screening people because even though COVID is here, the devil's not sleeping and lung cancer is still doing its damage, and we need to start getting back into that fight and not forgetting about the fact that while we're fighting COVID, we still have other battles that we need to work on.
Right. Well, Dr. Naravetla, thank you so much for a wonderful presentation this evening. I think the questions you've answered and the information you've provided will really help our community folks combat lung cancer and be more aware of the dangers, the treatments that are available, and screenings, and work towards more wellness. We really appreciate this.
Thank you. Thank you for having me. It's been my pleasure.
Yes.
Thank you, everyone, for watching this story and the question and answers. I wanted everyone to realize that compared to 10 to 20 years ago, where the story of lung cancer was quite grim, we didn't talk about it, and people usually died, and it wasn't a very comfortable death. We have made so much progress since then. We have the shiny Excalibur tool so we can catch lung cancer early. We also have these specialized nights that have gotten so much better. So if we catch the cancer early, then patients can actually get a curative resection without as many side effects. For people who aren't candidates for surgery, we have the specialized radiation surgery that can still allow them to get treated. And for those patients who unfortunately may still slip through the cracks and not show up until they have advanced disease, we have all these immunotherapy and targeted therapy options where before patients may have only had a few months to live, and now many times they are still living for years after a diagnosis of advanced lung cancer and living comfortably. And above all that, we have hope in the fact that people like you are watching this video and sharing this information with their friends and their loved ones and spreading the message of lung cancer awareness so that we can together make a difference and make even more progress until one day we annihilate lung cancer and get our happily ever after.